Good afternoon or good morning, depending on where you're joining us from. It's 3 p.m. here in the UK and 10 a.m. Eastern Time, and you're all most welcome to join us here at 0 Days Live. Now, today, as you'll be aware, is Thursday, and that means shortly I'm going to be joined by a very special guest, John Noble, CBE and Non-Executive Director of NHS Digital. But before that, I wanted to do a quick recap of yesterday's show where we met James Stickland, CEO of Authentication Specialists, Viridium, to discuss the subject of digital transformation and how the extraordinary situation we all find ourselves in now has meant a rapid adoption of digital transformation initiatives, particularly to support remote working, whether companies were ready for that change or not. Now, welcome back everyone to our virtual studios today, where we are welcoming a very special live guest every weekday for at least 40 episodes, and today marks our 17th live show. Tomorrow, we will be joined by industry commentator Clive Room of Pulse Conferences, and he will be giving us a roundup of the week and a look back at what's been going on in our Fun Friday edition. Our usual dress down day becomes 80s themed, and all of us here at 0 Days Live will be embracing the dress code, so do tune in. As usual, I'm in the chair to meet and greet our guests each and every day. My name's Stuart Reed, and I'm with Nominet, focused on cyber solutions. Now, Nominet is primarily known for being responsible for managing the .uk domain, which we have been doing successfully for over 23 years now, with something in the order of 15 million domains under management. And building on this strong heritage of understanding the importance of domain names for network connectivity, we also provide cybersecurity solutions to protect both government and enterprise networks worldwide from cyber attacks, including providing service to the UK government's National Cybersecurity Centre. Ensuring people that are able to be connected, included and secure is at the heart of what we do at Nominet. And it's important now more than ever that we are able to be connected. And with that in mind, we wanted to bring you an interactive show to bridge the gap left behind by the lack of physical meetings taking place right now, and bring you 0 Days Live for everyone with an interest in or from within the cybersecurity community. But we're not just live, we're here for your convenience too. As always, each and every one of our live shows can be found at nominetcyber.com/0dayslive, which is the same page that you signed up from, so it really couldn't be easier. I'm joined front of house and behind the scenes here with a highly capable team, making sure that everything runs smoothly. And speaking of which, Steve, welcome back from your day off yesterday.
Hi, Stuart. You do realise I wasn't actually off yesterday, don't you?
Oh, really? Well, remind us then, what were you doing yesterday, Steve?
I was actually running 2 workshops for the public sector around our protective DNS.
Excellent.
And in fact, we had a number of people from the NHS on those calls, on those workshops as well, understanding how we can help protect those today and in the future. Great
stuff. Well, in that case, you are very well excused from yesterday, and welcome back to the show today. Can you believe it? We are on show number 17 right now. You've had 2 haircuts since then, haven't you?
I know, and I reckon I could get at least 2 more in by the time we get to the 40th show.
Now that sounds like a challenge. Willing to take you up on that. Now, for those of you that tuned in this week, you will already be aware that this week's burning question is, what is your best purchase since working from home? I've got a new one today. It's not strictly speaking, though, a new purchase. It is building blocks from my youth, which I've dusted down and given to the kids to keep them occupied. But actually, I'd forgotten quite how much fun it was, and I'm thinking that I probably get more out of it than they do. But they did help me build this little building here. It is our 0 Days Live HQ, virtual HQ. They built there, so it's got a little antenna so that we can broadcast live every day, and it looks pretty solid. So how about you, Steve? What's yours?
So early in the week, I was talking about my mouse mat, my 1990s mouse mat, and that was my best purchase. I have moved on slightly from there, and now my best purchase is my Raspberry Pi. I've been encouraging myself to learn about coding a little bit more, so I bought this Raspberry Pi, and I've gone one step further. I've now created my own network detection and response solution for my home network with an integrated SIEM solution. So you can tell that I'm a bit of a geek, and that's what I do in my spare time.
Excellent. Well, I'm looking forward to seeing that in action. So thank you very much for that, Steve. Now, as you'll know, we are building a virtual community, but this show really isn't the same with everyone without everyone else tuning in to join us. So we are delighted to welcome our regulars to the show, and also new audience members every day, as we do build an accessible community to bring people together, hear from others in the industry, get a round of what's going on in the news, share some thoughts on best practice, and of course, interject some good humor along the way. Now, with that in mind, we do cover a lot of important subjects, but we don't take ourselves too seriously. As a quick reminder, for each of our 30-minute or so shows, we are absolutely live each and every day. As such, there is bound to be some mild blips along the way, but when they do happen, we hope you agree it's just part of the authenticity of the show we're creating. And please do get involved. If during today's show or any of the other live shows that you join in, please do ask a question or give a comment. Use the console that is probably on the right-hand side of your screen, and Kerry will read them out during each and every webcast. And speaking of Kerry, how are you today?
I'm good, thank you, Stuart.
Excellent, glad to hear it. So I've asked Steve what his best purchase is, and I've given you an insight into my special one today. What's yours?
Brilliant. So before I tell you mine, we have one in from the chat already, so keep them coming in. But Shiva has said maths puzzles for her 10 and 12-year-olds. So yeah, keeping them busy.
Excellent, fun and educational, well done.
So for me, I'm going retro today. I'm taking a leaf out of Steve's book, and this actually is the best thing that I have bought during lockdown. My friends laughed at me when I bought it. Who needs a wall calendar at this time? But not only does it show me all the places I'm missing out on, it actually means that I can put down my digital chats, so I can keep track of where I'm supposed to be when, without having to look at extra screens. And what I'm hoping is at the end of it all, I'll be able to look back and see some of the creative stuff we did to keep ourselves entertained. So murder mysteries, quizzes, bingo, all the online activities that we've had going on during lockdown.
Excellent, what a great idea. And for everyone else tuning in, and thank you again for Chiba to giving us comments already, please do let us know what your best purchase is since you've been at home, and we will make sure we read them out. Simply type all of those questions and comments into your console on screen. Now, as I mentioned a few moments ago, today's very special guest is John Noble, CBE, who is Non-Executive Director at NHS Digital. So John, a very warm welcome from ZeroDaysLive. Thank you very much for joining us. How are you?
I'm very well, Stuart. Thank you for the welcome. I'm a bit intimidated having seen your building skills at the clearly high-level engagement on this event. So, but thank you.
Well, actually, it's both of my 4-year-olds that have really been should take the credit for that, and also for the colour scheme as well. So I can't take too much of that. But right on cue, our very first question for you, John, of course, is what is the best purchase you've made since working from home?
So I've spent the last 2 years travelling around the world, claiming to be working. My family don't believe me. They've presented me with a long list of DIY jobs. So what I'm trying to do is flatten the curve on those jobs by basically purchasing DIY materials from suppliers who promise not to deliver this side of the lockdown. So hopefully it's all going to be emerging in a few months' time, by which time I'll be back on an aeroplane again.
Excellent. I like the way you're thinking ahead there.
I've been positive.
Yeah, well, absolutely, indeed. And kind of speaking about the kind of current situation that everyone's finding themselves in right now, in this time of crisis, your experience in digitally supporting the health service has probably never been more valuable. Can you give us a bit of an overview first off of what NHS Digital does and what your role as non-executive director involves?
Yeah, of course. So NHS Digital is the information and technology partner for the NHS. That doesn't mean it delivers all of the NHS's IT. You know, as you'll be aware, the NHS is a massive organisation. Over 3 million people are employed in the NHS and the social care sector. And responsibility for delivering that IT and keeping it securely rests in the many organisations who are part of that structure. But NHS Digital plays a key role at the centre, providing some of the really important solutions. So one example, NHS Mail, which connects everybody, 1.2 million people log on every day onto that system. 40 million messages a day are going, of transactions are going across the system. So that gives you some sort of scale. One of the solutions is provision of prescriptions. And so I think nearly 2 million prescription items are delivered every day. So NHS Digital's providing all of that.
Wow, and there's some pretty big numbers there. And I guess one of the things that perhaps puts cybersecurity on the map for kind of the mainstream and made it something that everyone was starting to become aware of and talk about was, of course, one of the largest cyber attacks to arguably hit the NHS, which was the WannaCry incident in 2017. Can you tell us what work has been done to improve the cybersecurity in the health service and social care systems since that incident?
Yeah, of course. And before I do so, I'll answer the part of the question which I really missed, which is what I do at the moment. So I'm responsible for running a group, a committee which looks at information assurance and cybersecurity across the system. And I'm helped by specialists from National Cybersecurity Centre, from NHSX, who do the delivery of strategy, Centre for Protection of National Infrastructure, and the Cabinet Office. And that's one of the many recommendations that fell out of the review post WannaCry. And I think WannaCry was clearly a wake-up call, a very painful wake-up call for the NHS about the level of risk that was out there. What was put in place was a whole programme of work to improve that security and get a better balance between security, cost, and usability. So some of the initiatives which have sort of come since then, the creation of a Cyber Security Operations Centre run in partnership with IBM, blocks over 21 million malicious items a month on average. So that's the CSOC which has been created. It's provided licenses to NHS organisations to allow them to upgrade to Windows 10. What, of course, comes with that is advanced threat protection. That now, I think, is on about 1.3 million endpoints. And that gives us a really good view, both centre and locally, on what is happening within the network. I think they've got much better at sharing information, a lot from the NCSC on critical threats, and then ensuring that there are standards set for updating or putting in critical updates. And then sort of finally setting standards for where people need to be, whether it's through, there's a data protection toolkit, data security and protection toolkit, which people have to go through in order to be able to connect to NHS Mail. So a whole host of initiatives to try and tackle some of those challenges that we found after WannaCry.
Okay, great. And in terms of, you touched on it in your earlier point in terms of some of the large scale things that NHS Digital is doing to support the wider health service. You touched on prescriptions and also the 111 service. What else is being done in the current pandemic that we're seeing right now to support the rest of the NHS?
Well, there's the really fantastic work from NHS Digital, and we're just really struck when you hear the range of it. I can't go through all of it, but I'll talk about sort of three chunks of activity which are underway. And the first, and arguably the most important, is to support the frontline workers who are doing such an incredible job at helping people who've been hit by this terrible disease. So there's things like supporting the rollout of the Nightingale hospitals. Some of the work is designed to actually take the pressure off frontline staff, like GPs. So for example, the 111 online service, which is where you would go if you were ill, and you would go through a triage process, and it will provide you with advice on what you should be doing. That was set up in late February. And that and the NHS website is where you go to for advice. Now, they were tested because we knew there'd be an increase in volumes to almost 12-fold, I think. We ended up, in fact, at 95 times fold what it was originally. So it's normally about 100,000 people, 10,000 people a day would visit that site pre-coronavirus. Over 1 million people a day were looking at it in
Wow.
mid-March. So setting that up, and also things like being able to get an isolation note rather than go to a GP. Over 1 million isolation notes have been issued through that system. That's 1 million people who haven't had to go to their GP. So the stuff around helping the clinicians. The second bit is about how we use data. Data which informed that list of people who need to be shielded. I think it started off at about 900,000 was the baseline work. We're now at about 1.2 million. That's been generated by a combination of NHS Digital working with the partners right the way across the system and refining it and moving it on. And the sort of third area, and probably most relevant for there, is just keeping the system going at a vital time. And clearly cyber is a really important part of that. How do we protect ourselves against the various cyber threats? And there's a couple of specific things which I wanted to go and mention about what's underway now to ensure these systems continue to be available. So one is working with the NCSC, made available specialist cybersecurity advice to support trusts and local organisations who may have vulnerabilities or, God forbid, have got some sort of security incident, so it can be resolved quickly. There's work about improving threat hunting capabilities and enhanced sharing. A lot of great work with the National Cybersecurity Centre looking and detecting threats against the NHS. Supporting remote working, and finally rolling out the protective DNS, which of course is something which is being done in part with partnership with Nominate. So a range of stuff to make sure that the NHS can do what it really needs to do to help us through this.
Wow, thank you for that, John. And again, you're touching on some really eye-watering numbers there, and I think it just helps to kind of paint the picture or create the scene of the enormity and the criticality of the digital services that are really behind the scenes to support what's going on frontline for NHS. So I appreciate you giving us a bit of an insight to that. Now, as regular viewers will know that Steve randomly will pop up on screen, which usually means that he's raising his virtual hand to ask some questions, and he's not let us down today. So what have you got to ask, Steve?
Yeah, so I was really interested, John. Obviously, a huge range of things that you're doing there to help at the moment. But on the issue of data, you mentioned the enormous amount of data that you must be processing at the moment and have there to access. So in these extraordinary times, how is that data being used for statistical and investigational purposes to learn more about and combat COVID-19?
So you're absolutely right, Steve. So the data is central to understanding what's happening within the community about the disease, and then allowing us to take action. So let me give you one example of how it can be used. So I talked a bit earlier about that 111 triage system. So that's what you're going through. You're going through your symptoms, and it's in effect logging that you have got this terrible disease. You can take that data, which is what NHS Digital is doing, and working with some of the best data scientists in the country from various academic institutions. And it's then using that data to say, okay, this means that in this particular area, the intensive care unit is likely to go and see this number of people surging to go and see it in so many days' time. So a small example of how you can take one small chunk of data, nevertheless very important data, and you can use it to help the frontline staff, because you can reinforce that intensive care unit. You can make sure extra beds are going to be available. So there's a number of things around that, as well as, of course, the research which is being done on the disease, which make data at the heart of how we respond to this terrible disease.
That's amazing, and we all know the importance of that data and how important it is to keep that kind of highly sensitive data secure, and perhaps some data will be more sensitive than others in terms of the depths of the type of data you have there. But we also know that the value that has to hostile actors, and we know that obtaining healthcare records is often one of the first things that these hostile actors want to do. Is one of the most valuable pieces of data they can get. So how do you protect that data? You know, is it anonymized? Are there any other additional security and governance considerations you have to put in place to put the right protection on that kind of data?
Yeah, Steve, you're absolutely right. This data is really valuable. If we lose it, we undermine the citizens' sense of their trust in making it available to us. So protecting it is a really high priority. Yet we've got to go and share it with partners to be able to go and use it, you know, with the researchers, etc. So in effect, there's two things which we need to do to be looking at. First is why does this information need to be shared? Is it a very valid reason? So that's about having an information governance process which allows us to look at that. And secondly, is that organization, are they going to protect it to the required standard? Making sure that standard is going to be high enough. Now that's quite difficult because everybody wants to share this stuff quickly at a time of crisis, but you have to be asking those questions. Does this organization need this data? And is it suitably protected? Whether that's anonymized or there's some other protection that you need to put in place, we need always to be thinking about ensuring that data is properly protected.
Thanks, John.
Great. And on that point, actually, because we touched on in the previous question the kind of the cyber criminal angle as far as this data is concerned, which of course means that, you know, there's invariably going to be some cyber threat and some activity. What else are you seeing out there in regards to cyber threat, and how do you think healthcare and other sectors will be impacted digitally by the rise of these threats during the current pandemic crisis? We've heard the last week or so a lot of news reports around COVID-related spoof domains being created or spoof websites and phishing attacks taking place. What is it you're seeing from the NHS Digital side?
So it's true, you're right. The degree of risks that we're carrying, because we cannot afford to lose these systems, has definitely gone up. I think it's worth, you know, really emphasising that healthcare has become an important target, particularly for cyber criminals. And in the run-up pre-COVID, what we were seeing, especially at the end of last year, was a series of very high-profile ransomware attacks against healthcare organisations, particularly in the United States, but also in Europe and elsewhere in the world. And indeed, we saw attempted attacks to compromise parts of the NHS supply chain. So that's something which is always there. But we're starting to see repositioning as cyber actors start thinking about how they exploit COVID, and whether that's the large ransomware groups, even though some of them claim that they're not going to do anything, we can't believe them, or whether it's cyber lower level cyber criminals who are doing things like, you know, business email compromise to exploit this remote working that we're all being able to do and having to work at pressure. And of course, also seeing nation states. Some nation states see cyber as an essential part of their furthering their national infrastructure. So all of this points to the fact that there's a repositioning to exploit COVID-19, and we have to be prepared for that.
Yeah, and I think you're touching on it, and again, or underlining an important point that, you know, partly the reason that it's perhaps a bigger target is because it's something that is critical to everyone. It doesn't matter what industry you're in. It's something that does, or potentially does, impact everybody's day-to-day life. So thanks for that, John. Kerry, I know that this is a subject for all of those reasons that has resonated a lot with the audience. What questions are coming in?
Yeah, so we have one from Gary Foote from the HACCP1 team. He is asking around does the UK collaborate with other national healthcare organisations to learn together on combating crime for healthcare?
So I think it's a really good question, Gary. I think we collaborate with other healthcare organisations, learning about best practice, but of course we also collaborate internationally through organisations like the National Cyber Security Centre, sharing information about threats. And we definitely need to do it, because these groups who are targeting I know a Spanish healthcare organization will also be targeting the NHS. So creating a system where we're sharing through certs, but also sharing through healthcare organizations is really, really important. And not least, this best practice thing is really matters, because in healthcare, like everywhere else, you've got to strike the right balance between security, usability, and cost. And it's really difficult in healthcare because you want to put the money towards protecting people. So working out what really is effective to protect your patients and your staff is a really important thing that we need to do, and make sure that we're sharing effectively.
Brilliant. And then we have one from Joyce. She's asking, do you think that some of the rapid IT changes made to cope with Corona would change the way the healthcare service runs long term?
I'm sure that you will. I think there's going to be, it's an awful thing to say, but there will be some benefits from how we do this. You know, we're living our lives now using video conferencing. That can be a really effective way for frontline physicians to be able to go and speak to a lot of patients. So I'm sure that, you know, we put in place, working with GPs, a lot of video consulting routes. I'm sure that's one of the areas which will stay with us, and hopefully there will be a number of benefits that we can take from this, whether it's around cybersecurity or delivering care to patients, that we will want to continue with post this terrible disease.
And so one in from James, how important is the supply chain in the overall security of the NHS?
I think it's really important because we all use third parties to help us. And we've got to make sure that those third parties have the same standards as we do, whether they're holding patient data or whether they're supplying a critical system, the loss of which could impact. So like everything else, you know, we have to understand our supply chain. We have to work with our partners to make sure that we're doing everything possible to protect that. And I should say that there's been fantastic engagement for the private sector supporting the NHS. It's been one of the really, really positive things.
Yeah. And then we have one from Harrison saying, what advice do you give to industries who typically aren't technically savvy to help them become more secure?
I think, I'd follow the NCSC advice. This is about getting the basics right. It's about concentrating on getting your cyber essentials in place, following the guidance and making sure that's doing. I think at the moment I'd really be focused on phishing emails as an indicator, an early indicator of attack. And I've really endorsed the NCSC's latest initiative around reporting phishing emails to them, so they can use active cyber defense, which again I know Nominate's part of, to bring down these hostile domains. So, use report at phishing.gov.uk. It's a new way of reporting. It's definitely something whichever sector you work at, we should be all doing.
Yeah, and then the last one from me is, what do you think are the most important things an organisation can do to encourage a more secure business? And that's from Raj.
Okay, so I think, as I mentioned, getting the basics right. I think we'd include that, all the stuff that we've known. It's around patching, it's configuration, it's around credential management. But it's also about understanding your system, understanding the risks that you're carrying, and what really matters to you as an organisation as what is critical, and then applying an appropriate degree of protection. And then finally, at a management level, taking an interest in cybersecurity and making sure you're making the right decisions to keep your organisation, and of course, in the case of the NHS, it's patients and staff safe.
Brilliant, thank you.
Great questions, everyone. So thanks to everyone that's asked those today. As I said, John, this is clearly a subject that resonates with our audience, and also wider than that as well. So thank you very much for your time. It's been both fascinating and insightful, and as I mentioned before, the criticality of securing the health service, it really is something that impacts everybody, and there's clearly a huge reliance on the excellent work that's being done at the digital level of the NHS, that's there to support the work that's being done on the front line. So thank you very much for sharing the work that's being done there, John.
Thank you, Stuart. The best of luck for the next 23.
Thank you very much. Now, before we wrap things up here today, just about time for us to turn back to Kerry to give us a wash-up of today's news stories.
Brilliant. Before I do, Steve, there's a question for you. Where are you, Steve? Hello.
Here I am.
Kahindi has asked, what is the make and model of your Raspberry Pi?
It's the 3. I went for the 3 model, the 3B, because they didn't have any of the 4 in stock when I wanted it. So I would have gone for the 4, but I went for the 3B instead.
Very honest answer there, Steve.
Absolutely nothing to me. Cool, thank you. Well, we have some interesting stories in the news today. So ZDNet reports that the Chinese Ministry of Emergency Management was targeted by a hacking group known as Ocean Lotus, which is linked to the Vietnamese government. Twitter has said that there's no evidence of bot networks being used to manipulate conversations around the corona pandemic in the UK. And that article was written by Alex Hearn from The Guardian. And then finally, and perhaps most relevant to the conversation we've all been having today, Computer Weekly reports that the NCSC has a huge response to its coronavirus campaign. John obviously gave us the link earlier. So in the first 24 hours, they've taken down 83 malicious web-based scams and have received over 5,000 reports of suspicious emails. So keep doing it.
Excellent. I see you popped up again, Steve, which means you must have something to say.
Yeah, it's just interesting. The news yesterday, I know you spoke about the decrease in ransomware attacks on US government agencies in the first quarter. And I just wonder if we've been speaking about a number of things over the past few weeks. One is the tendency or the suggestion of not to pay ransom when you get ransomware. I wonder if that's having an impact, and therefore, you know, the economic process of these criminal organizations means that they're not targeting those agencies because they're not paying. Coupled with the fact that of the COVID-19 situation and people taking advantage of that, whether the criminals are now actually focusing their efforts on bigger campaigns that are kind of more, you know, in mass for that low-hanging fruit of COVID-19, and then that also leads to make me think that perhaps there is there's a ceiling of capacity of these criminal organisations in terms of what they can actually do and focus on at any one time. So, you know, are they like any other organisation? They have a limited amount of resources and just have to point it as to where they see the best returns. It's just really interesting to see how it's working.
Yeah, and it is interesting to see how these things start to develop as well, and especially, you know, looking at the Computer Weekly report that Kerry's just read out, that it clearly, from the conversation we just had with John, the work being done to protect the NHS from a digital perspective is nothing short of phenomenal. Really impressive stuff. We've heard some really big numbers that John's talked about today, which I think helps to give us the kind of the scale of the importance of digitally securing the health service. And we've heard from John firsthand some of those efforts behind the scenes. And it's clear that with the initiative that NCSC is also kicked off in response to kind of the pandemic that we're seeing right now, is working really hard behind the scenes to make the online world a safer place for us all right now. Really positive as well to see that it's not just the agencies that are getting involved here as well. There's the public are really engaging with this as well. So giving the feedback of what they think are potentially malicious or suspicious sites back into that system for further investigation actually shows it's a real joined up effort. So it's kind of a joined up effort to make sure that we're all looking out for each other to remain safe online as well. So yeah, really interesting themes of stories that are starting to develop here, and I'm sure there'll be more as we go through the rest of our live shows. Well, that is it for today, everyone. A very special thanks to today's guest, John Noble from NHS Digital, to everybody here front of house and behind the scenes at Zero Days Live, and of course to all of you for tuning in. And don't forget, as I mentioned at the top of the show, tomorrow is the end of the working week for many, so do join us for our Fun Friday edition, we'll be meeting industry commentator Clive Room for a review of the week, and we'll be adopting an 80s themed dress code, so don't miss that. Till then, have a great rest of the day and see you again tomorrow. Goodbye.